Late last year, we started to see a cluster of unusual pneumonias come up in China, and that's when we first started to get an indication that there might be some sort of new, novel, emerging infection that was going on. And as we were following the progress of this cluster of unusual pneumonia illnesses in China, there was more information that was evolving, and then subsequently, scientists were able to identify this novel coronavirus. Definitely want to remind all healthcare facilities to be reviewing their infection control plans, whether in the middle of an emerging infectious disease issue such as COVID, or just kind of routinely, just to make sure that they're following infection control guidance, proper protocols. All healthcare facilities should have plans in place regarding dealing with respiratory illnesses, because we have to remind ourselves that every single year we see seasonal flu, we see respiratory illnesses emerge every single year. And keeping those infection control plans in mind and exercising those infection control protocols are really key to not only dealing with the routine, but also a step toward the prevention of emerging issues. As with other respiratory illnesses, we want to ensure that people follow those common sense things that we do for instance, when we're in the middle of respiratory virus season, covering your cough, making sure that you stay home when you're sick, making sure that you go see your healthcare provider if you're concerned about your health, and to give a call to your healthcare provider ahead of time so that they can be prepared for your coming. Well, with this COVID, this novel coronavirus illness, we're seeing a lot of individuals with severe respiratory illnesses. So a lot of the cases that we're seeing have fever, shortness of breath, cough, a lot of lower respiratory tract illnesses, which are a little bit different, a little bit more severe than what we've been seeing with your routine respiratory virus illnesses. Currently, in the U.S., we are looking at different criteria for COVID illnesses. And for now, the criteria are looking at individuals with a history of exposure to like the hot zone, Hubei province in China, or contact with individuals who are confirmed cases of COVID, and with clinical presentation of fever and respiratory tract illness that include fever, cough, shortness of breath. The information is still evolving about the transmission of the virus that causes COVID-19 illness. And we have seen limited person-to-person spread. Primarily the person-to-person transmission that we've been seeing has been in China primarily. Here in the U.S., currently, as of mid-February, we've only seen about 15 cases of COVID in the United States associated with travel to China. And of these, there were only 2 that were associated with person-to-person spread. With novel and emerging infections, we don't know too much at the beginning, so there's always the challenge of dealing with potentially changing case definitions, potential information that becomes more evident later on as we get more information. So, we always try to get the balance of, ensuring that we get the message out there to clinicians that sometimes things will change. Sometimes when you're looking for illnesses, you might need to modify what you're looking for based on the newest information that's available. The emergence of any new infectious disease, we're always concerned about that. And currently, right now, we're also very concerned about the emergence of COVID-19 and how that might evolve and how that might impact what we see circulating in the community. But, it's important to know that this COVID-19 emergence is also occurring simultaneous to our regular seasonal influenza. What we're seeing in New Jersey as well as elsewhere throughout the country is that, we are seeing peak activity of influenza right now. January, February is typically around the time that we see peak activity. So this is an opportunity to remind everybody to be mindful that, if you haven't gotten your flu vaccine yet, get vaccinated for flu. Take those easy steps, cover your cough and sneezes, make sure you wash your hands all the time. Stay home when you're sick, that those types of precautions are helpful not only for seasonal flu, but also for whatever might be emerging.